Hi, guys. So today we'll be talking about health conversations with LGBTQ digital storytelling for HPV vaccination. My name is Dr. Darville, and this project was supported by Provost Office C grant at Mercer University. I have several collaborators who are working with me on this project. Dr. Nguyen in the Mercer College of Pharmacy, Mr. Mandela at the University of Georgia LGBT Resource Center, and three of my undergrad researchers who have joined me today for today's presentation, Ms. Khan, Ms. Alcorn, and Ms. Hawk.
So the background of this research study was to collect information that will inform a digital storytelling campaign / documentary series surrounding HPV vaccination among the LGBTQ population. The design methods were as followed. Sampling was employed and participants enrolled using SuperSAS software. Participants were emailed the informed consent and demographic survey to complete prior to participating in the interview. There was 47 interviews that were conducted over Zoom and audio recorded for transcription. The interview sessions lasted between an hour and a half, and participants were then compensated with a $40 incentive. The transcripts were then cleaned and coded for data analysis.
The demographics of those who participated in this research study. Individuals were between the ages of 27 and over, Caucasian, were assigned female at birth, identified as a man, were gay, single, and had health insurance through their employer. They engaged mostly in unprotected oral sex, had been sexually active in the last 6 months, and had 15 to 29 total lifetime partners. The majorities had never had an STD, had not been vaccinated for HPV, and were HIV negative.
As part of their demographic survey, we also asked them questions pertaining to their risk for HPV. Questions and statements that we asked included how likely they were to get HPV, the risk for HPV, how serious and severe it would be to the quality of their life, their health, and their overall sex life. When we asked about their risk of getting HPV or their likeliness of getting HPV, our population overwhelmingly strongly disagreed that they had an increased risk to get it. When we asked concerning the risk being high, again, they disagreed that they did not perceive that they had a higher risk because of their sexual orientation and identity. We asked them about, the severity or the seriousness to the quality of life. And many of our participants were very unsure about how HPV affected their quality of life. But lastly, when we asked them about the severe threat to their health as well as their sex life, our participants either strongly agreed or just simply agreed that HPV was going to be effective or affect that part of their life.
We collected a vast array of information over the course of our health conversations. The information could have fallen into any one of the following themes: being a part of the LGBTQ community in the South, quality of healthcare, HPV and HPV vaccine awareness, influence of HIV status on vaccination decision, and documentary creation. As far as the experience of being LGBT in the South, many felt as though they should be ashamed. That sentiment was then echoed by healthcare providers, where one participant recalled, quote, "My general practitioner has no clue about gay people. He doesn't ask about my sex life. He never asked me if I was gay. If I had to find time to bring it up. And within a few minutes of me ever telling him that I was gay, he was like, oh, have you had an HIV test?" Or HPV vaccination and awareness. Many thought that the vaccination was geared towards teenage girls upon viewing a commercial about the vaccine. Additionally, HIV status did not influence their decision to get vaccinated, as they did not know about the vaccine until a provider had mentioned it. In documentary creation, many of our participants agreed that the documentary should be inclusive, as HPV is a universal issue. In the same vein, the documentary should be accessible to be distributed through social media without the use of heavy jargon.